my project was on reducing burnout in emergency department nurses, and it was basically a list of things that nurse managers could do to reduce ED nurse burnout. So some background on it, ER visits are up 37% from 1995 with a peak of 124 million in 2010. And the CDC predicts that this number will grow by 5% each year. So some definitions before we go into the actual literature. 3 words that you need to know. So burnout is defined as hopelessness and loss of ability to perform your job well, and applies to many professions, not just nursing. Compassion fatigue is a type of burnout that happens in jobs involving empathy. It's a sort of emotional exhaustion. So the difference between compassion fatigue and burnout is that empathetic element. So nurses probably get more compassion fatigue and burnout, but compassion fatigue is a category of burnout. Compassion satisfaction. So compassion satisfaction is satisfaction with your job and your work by helping others and being able to do your job well. So before we go into all the negative things about ER nurse burnout, it should be mentioned that a lot of nurses enjoy working in the ER. They enjoy the fast pace, the continual learning, and the unpredictable nature of the ER. So it is possible to feel happy as an ED nurse. So some facts about why we should care about nurse burnout, why it's a problem, is a study done by the University of Singapore measured the stress hormone cortisol in the saliva of ER nurses and found it to be significantly higher than a lot of other nursing specialties. Sorry, my cat's distracting me. Okay, back to some other tests or some other studies. A lot of different universities have done stress self-evaluations for ER nurses versus other nurses and found the stress levels to be higher in ER nurses. Another study found an increased rate, 12% of ER nurses have signs and symptoms of PTSD. So burnout manifests itself not only in the workplace, as shown by emptiness and inability to complete your job well, but also in a nurse's personal life, as her stress at work, his or her stress at work, translates over into their interactions with their family and friends. But in the workplace, it can also translate into poor patient care, or increase in sick leave or nurses leaving their job, which causes nurse managers to have to train new hires and causes bad nurse attrition. So one really interesting study that I mostly used for my paper was actually done by a faculty member at BYU, Stacy Hunsaker. She did a study on specifically which nurses are at risk for compassion fatigue and burnout in the emergency department. So what she did was she mailed out 1,000 studies to a research list through the ENA, Emergency Nurse Association, and she got 284 studies back, and what she found when she crunched all the numbers were that younger, newer nurses, either to the ED or nursing, were at the highest risk for compassion fatigue, meaning that the older nurses didn't have as much compassion fatigue. So some reasons for that could be that they are used to the ED stresses. They found coping mechanisms to manage their stress. They have more knowledge and so less overall stress about getting things right at work and more brain power for other things at work. And other people that were at high risk for burnout were the ADN and BSN groups were actually found equal, whereas the master's and doctorate levels nurses had lower levels of stress than the ADN and BSN group. So there wasn't really any difference between the ADN and BSN group. So I thought that was interesting. That would be us, the younger, newer nurses with the Bachelor's of Science degree. So So other people that are at risk, nurses that work longer shifts, as well as nurses that feel they have poor managership support, and that'll come into play later. So some things that nurses can do is they can establish a safe collaborative work environment for new nurses, um, and intervene when they see signs of compassion fatigue in other nurses, and not adopt the eat your young mentality as that many hospitals have, that I'm sure we've seen in our clinical setting sometimes. Older nurses can informally mentor newer nurses, just kind of reaching out to them and letting them know that they can bounce ideas off them or talk to them with any questions or anything at work. So as far as what newer nurses can do is they can maybe seek out a mentor like that. I'm sure any nurse would be flattered, older nurse would be flattered and say, hey, I was wondering if you could be an informal mentor for me. It's kind of a scary thing to do, but it's something that we as newer nurses can do on the unit. So another thing is work-life balance. A lot of the times, one thing I found that was really interesting, and Stacy Hunsaker brought this up in her study, that a lot of the times people look for fancy interventions to decrease nurse burnout when a lot of the reasons have to do with Maslow's hierarchy of needs: proper sleep, proper eating, proper breaks, exercise. And it's just really important that Maslow says that one needs to fulfill all their basic needs before becoming self-actualized and committing to a cause or vocation like nursing. So that's ensuring you get enough rest and sleep and eat. I know sometimes we don't always have control over that, but doing it to the best of our ability. Another thing that came up was nurses that tend to help others and not themselves. So one interesting metaphor I thought of for this was when something goes wrong with the cabin pressure in the plane and oxygen masks drop from the ceiling, you're told to assist yourself before assisting a child. And if I remember thinking, oh, that's kind of selfish, you should help your kid first. But this, if the emergency were to grow worse, it would actually be a lot more helpful. You would be a lot more helpful if you were alive rather than kept your kid alive, if that makes sense. So this applies to nursing, that if we help ourselves, we can be more helpful in the long run to our patients. That it's important to pay attention to our own needs first, even though that may not seem like what we were trained to do. So one thing the Hunsaker found was that the key modifiable factor, a lot of the factors that we talked about, like age of nurses and education levels, well, you can change that, but it is a longer intervention. But the key modifiable factor was nurse managers. Whether or not they felt they had, or the nurses had, managerial support. So some things nurse managers can do is concentrate on newer nurses, maybe set up a formal mentoring program where an older nurse trains a newer nurse. Try to have a collaborative relationship with your staff. And I'm sure we've talked about leadership, all the different leadership styles. So maintaining personal contact with their staff as part of having a collaborative relationship. Recognizing staff for achievements, doing debriefing sessions, formal or informal, which I'll get into later, and as well as paying attention to the literature. And for units that only have one nurse manager, like the unit I was on at the University of Utah, delegation in these things is okay, so that they ensure that the job gets done, even if they have a lot of nurses that they're overseeing. So a couple of the specific interventions I found for decreasing ER burnout were critical incident stress debriefing, which is basically a comprehensive integrative form of crisis intervention, which just deals with crises on a case-by-case basis, and kind of you go through 7 steps and debrief on or near the site of the event, which I thought was really interesting. If it happened in the trauma bay, debrief about it in the trauma bay. And 72 hours or less after the event to make it effective. And I won't go into the 7 steps, but maybe look that up if you have the time. It has a pretty clear structure, so it would be pretty easy to implement. It's not very complicated. So yeah, that's critical incident stress debriefing. Then another thing within critical incident stress debriefing is a personal reflective critical incident review. And this is something that you could do even if your nurse managers didn't assign you to. Just the nurse writes down what happened and their reactions in a journal, and it's personal and private, and then kind of puts the journal away and then comes back and reads it later so they can kind of look at the whole thing holistically and be able to see how they grew from the event. So writing things down, that's a good way to deal with the stress of the workplace. So another intervention that came up again and again and again was aromatherapy, music, and massage, which I honestly thought was kind of a stupid intervention because, I mean, it costs a lot. How effective is it really? But a lot of the studies repeatedly said that it was very effective. And actually, when I talked to the nurse manager at the University of Utah, they used to do this, have an on-site masseuse for nurses. And they say that just 15 minutes can reduce stress levels. And I know in Taiwan they had masseuses on site for nurses, so that would be something to think about. Mobile phone, or one other interesting study did stress inoculation training through mobile phones. So they just kind of gave the study gave half of the nurses the videos to watch on their phone, the other one watched control, or the control group just watched like random videos that didn't have to do with stress training. And they used imagery, behavioral reversal, modeling, role-playing, and graded personal experiments. And they wanted to use a mobile phone because it's an incremental acquisition of skills. They were able to watch the videos over like a couple weeks. And the material is always at the ready if the nurse ever needed it. And it also increased acceptance of the training. So that's an idea to kind of integrate the technology that we already have in reducing ED nurse burnout. So the last point I want to make is about healthcare reform, which I'm sure you guys just heard a lot about in the debate, but how it relates to burnout. Well, first, the burned out nurse is pretty likely to get low patient satisfaction scores, because normally burnt out nurses are just concerned with finishing their tasks and going home. And then secondly, causing increased focus on patient satisfaction scores is a lot more likely to burn out the nurse quicker. So just to get some material for this project, I asked one of the nurses on the ED unit to tell me what she thinks would reduce compassion, fatigue, or burnout. And she said, if I were able to say whatever I wanted to my patients, then I would just have a day where I could say whatever I wanted, then I would feel less burnout. And she's kind of joking, but I can see where she's coming from. Just the fact that she has to sugarcoat a lot of things because there's a big emphasis on patient satisfaction there kind of reduces how well she feels that she can do her job if she can't be honest with her patients. So where we can go from here is we can look at healthcare reform and how it is going to affect burnout, maybe do a study in a couple of years and see the patient satisfaction scores versus now, what the changes are, as well as what Jim has been telling us, to participate politically will give us more control over what's happening at work and make us feel less burnout. So, and as well as paying attention to the evidence-based practice and talking to your nurse managers about the best things to implement would also be a good idea. So that is my presentation.